All right, people, we're a little behind time. We had such a nice lunch, did we not? Yes? Who enjoyed their cupcake? Megan and I have a joint love of cupcakes, so that was the source of that. So thanks for coming back. I know it's hard to sometimes come back after lunch. Your belly is full and you're tired, but hopefully you had caffeine or you're acquiring the same. Or if you're like me, which stuns my students that I don't use caffeine at all, I have natural energy, the likes of which should not be normal. In any case, so I'm actually mostly going to turn things over to my colleague, Kerri Lowrey. I just do want to remind you of a couple of things. One is, if you did not get a copy of the evaluation form for the conference when you came in, please raise your hand and Megan's going to make sure you get one. You guys are in public health. You know how important evaluation is. Most importantly, our grantor, who I should have thanked in the beginning and didn't, which is the Robert Wood Johnson Foundation, really relies on these to make sure we're doing good work. And, and then we use it qualitatively for us to understand what we did right and what we, could improve upon for the next time. So really appreciate you taking the time to fill those out. And then you can just, at the end of the day, leave them on the table in the back, or if you see me or Megan or any of the staff, you can hand them to them. Was there anything else you wanted me to say, Megan? Great. I say whatever Megan tells me to say. So I'm really excited to turn things over to Carey because everyone, again, I feel like I'm having a family reunion with these speakers here today, but every one of the panelists here and Carey are dear friends of mine, people who really are making a difference every day in public health. So on that note, I turn it over to Carey.
It's so easy to get applause from this crowd. And for my next trick, it was. Okay, good afternoon, everyone. We have assembled for you a great panel this afternoon, and this will get you through the post-lunch slump for sure. This panel is on preemption in public health. I think at least most of us realize what a huge issue this is in the practice of public health. All of our panelists come to us with amazing credentials and experience, but in their humility and just desire to get down to business, they actually asked me not to read their full bios, but just to give you their names and their affiliations. So, without further ado, you will first hear from Jennifer Pomeranz. She's assistant professor at the NYU College of Global Public Health. Jennifer is going to talk about, first of all, what is preemption, and then she'll talk about the equity, kind of social and public health implications of preemption on a more 30,000-foot perspective. And then next we'll hear from Lainie Rutkow, who's a professor at Johns Hopkins Bloomberg School of Public Health. Lainie's going to talk about a study that they just completed of mayors and local health officers, specifically on the issue of preemption and how it affects their work. And then finally, last but not least, you'll hear from Glenn Schneider, who is the Chief Program Officer at the Horizon Foundation. And Glenn is really going to give you the kind of boots on the ground, experiential kind of perspective of preemption. And so, Jennifer, I'll turn it over to you.
Hello, thank you for having me. Let me find out, oh, here's the, okay, so I'm going to be talking about equity and how public health, first I'm going to define equity and then talk about preemption's effect on equity. So first about equity, I think we might come from some of you might be from legal backgrounds, but in the public health world we talk about equity a lot, but so just a little 101 on equity. Equity is the avoidance and the absence of avoidable unfair differences amongst groups of people. And so in the health world, we think of wanting everyone to have a fair opportunity to attain their full health potential. And in the World Health Organization and worldwide, this is very recognized. In the US, these are less recognized rights, but we still think about them in public health. And so health inequities, which is something that we definitely have in the US, are systematic differences among the health status of populations arising from social conditions. And some of these we call the social determinants of health, so social conditions that are determining poor health outcomes and health inequities. And we as lawyers have a real role to play because these can be reduced and avoided through the right mix of government policies. So law, by definition, is a social determinant of health because our legal frameworks are the things that decide what are going to happen for all these types of things. Everything from things that we would automatically associate with health outcomes like housing, transportation access to healthy food, but even down to civil rights, environmental protection, and other things. Even political corruption. These are determined by the legal structures and frameworks in the US which create health inequities. So now that we're all on the same page on health equity and inequity, we're here to talk about preemption today. So preemption is when a higher level of government withdraws or limits the authority of a lower level of government to act. And we see that the federal government can withdraw the ability of state and local governments to act, and states can withdraw the ability of local governments to act. It's very common that the federal government will act and then also say that states can't do it. And the most common example is food labeling or other products labeling, tobacco warning labels, those types of things. The federal government enacts a substantive law and then tells the states, you can't have different laws. And in a lot of ways, that makes sense. If every 50 state had a different nutrition facts panel requirement, it would be very difficult for businesses to do business across 50 states. So this makes sense. But that's not what we're here to talk about today. What we're here to talk about today is states taking away the ability of local governments to act in an effort to avoid evidence-based policymaking, and they're doing this because they have other interests in mind. And so this is where the preemption becomes a problem. And just as a point, I want to make sure everyone's clear because this is often confusing, especially among progressive law and public health people. The Civil Rights Act is sometimes thought of, oh, this is preemption, this is good preemption. No, the Civil Rights Act is minimum standards. It provides minimum standards for protection of civil rights and allows state and local governments to go further. And I'm going to give an example of why this matters. Preemption, on the other hand, is when the state is telling the local governments you cannot act. And in most cases that we'll be talking about today and that of any concern for public health, the local governments cannot act, but the states are not acting either. So we're in a regulatory gap for the most important policies in America. And if I had 40 minutes, I would show you all the horrible things that are happening around the country, but I don't, so I'm only going to talk about a few. So two types of impact that preemption's having on equity are states are actually enacting preemptive laws for the express purpose to reduce equity. And I'm going to give you a few examples of that. And then secondly, states are ignoring public health and they're trying to serve other interests, most notably special interests and those of corporate interests. And I'm going to give you examples of both. So first, the express purpose to actually undermine equity. The Civil Rights Act, as I just mentioned, does not protect discrimination against LGBTQ individuals in our country. So, for example, 22 states have laws that protect employment discrimination against either or and sexual orientation and gender identity. But Fayetteville, Arkansas tried to also enact a civil rights protection for LGBTQ individuals, but unfortunately the state of Arkansas did not like that, and so the state legislators on purpose preempted all local civil rights statutes for the express purpose, it's in the legislative testimony, because they did not want Fayetteville, Arkansas to be able to protect LGBTQ individuals. So they expressly preempted the civil rights statutes and were very vocal about their rationale. Unfortunately, the Arkansas Supreme Court just upheld this law about 2 weeks ago. I'm hoping they file a lawsuit in federal court on equal protection and establishment clause cases, but we have to be seen if that happens. But anyway, this is the law of Arkansas, and this is similar to Tennessee, which previously did this, but was not as vocal about their rationale, although they had the same purpose. Another example, Kansas, it has the most far-reaching preemptive law in the context of food policy. It preempts the most amount of topics of any other state in the context of food. And they also preempted the control over a made-up term called food-based health disparities. Now, we know what health disparities are. We know what food is. Joining them together in an undefined term it creates a chilling effect on local governments now who cannot know what they're doing to maybe violate this food-based health disparity preemption. preemption. The other thing that's kind of fascinating about Kansas, it's the only state out of all the states that preempt food policy that actually preempted itself. The state legislator actually said no local jurisdiction nor the state can enact a law on about 5 different topics, including food-based health disparities. So the state is actually expressly saying we're not addressing this topic either. And so, unfortunately, this is very concerning because of even the language, but also local governments tend to be the best positioned to address disparities because they're actually closest to the people, can identify the disparities, and also with local involvement can address them much better than a state which probably doesn't even know what disparities are existing. And local governments can coordinate amongst each other and their communities within their jurisdiction to address this. So this is another example where they're directly trying to address equity in the context of food. And then the last example where it's clearly on purpose to reduce equity is the case of Alabama. So I really want you to note the date, that on February 24th, 2016, the mayor of Alabama signed a bill that became a law for minimum wage in Alabama, $10.10. The very next day, which is unheard of in the world of legislative the progression of bills to law, not only did the Senate approve, but on the exact same day, the governor signed a law preempting all local minimum wage laws. They enacted a law called the Minimum Wage and Right to Work Act. So it preempted all local laws, and they mandated uniform minimum wage, which, by the way, in Alabama, they don't have a minimum wage. They just go by the federal law. They're one of, I think, a handful of states that only use the federal minimum wage, which is $7.25. This was an express purpose to preempt the Birmingham law. Unfortunately, in the courts, we thought we won in the 11th Circuit, where they thought that there was a tenable claim of equal protection discrimination. And then just last week, the 11th Circuit agreed to have an en banc hearing of that, and they are rehearing this case, which we expect will not go in that direction. So we will likely not see any movement on equal protection basis here. So this, again, is the law of the land, and the whole express purpose was to preempt the minimum wage law, nullifying the Birmingham Ordinance. So now on to preemption that, while we don't know what's in the legislator's mind, but it clearly affects public health and equity, but maybe they're trying to just favor other interests, although you don't know. It's not always that we have the express, obvious answers. So evidence-based policies are policies that are scientifically proven to save lives, increase lifespan, and improve quality of life. And so when states start to preempt evidence-based policies in favor of other interests, you start to become alarmed. So the Community Preventive Service Task Force, this is one example, recommends smoke-free air acts, which protect us against secondhand smoke and also have actually helped reduce smokers and increase the quitting rates. Yet you can see all these states in red preempt the ability of local governments to enact stronger smoke-free air laws in these states, which this is one of the most evidence-based public health policies there is, and we still are seeing preemption of local smoke-free air acts in these states. Another thing about smoking is that it also disproportionately harms lower income communities because they have less access to health care. They tend to smoke heavier. If they do get lung cancer, it's identified later, and so that creates even a further divide in inequities in these communities. Another area, firearm violence. This is where we see the most preemption in the entire country. We also know firearm violence disproportionately affects communities of color. Yet we have 43 states in the country that preempt local firearm laws, and these states are not filling the gap with stronger laws. If you look at like the Gifford Law Center, you'll see that the states without preemption are also the states with the least gun violence and also the best gun laws. So these are coming together, and these red states are the ones that are protecting the firearm industry and enacting laws even at the behest of the NRA, which drafts model policies in this area. And then the last example, I just love this headline, Mississippi governor signs anti-Bloomberg bill. This whole point of this bill was because they did not want the soda ban, they called it, which was the sugary beverage portion cap that came out. The reason I love this is for a few reasons. The first is there's no more evidence-based policymaking ever in America since Mayor Bloomberg was mayor. There was the most evidence-based policymaking going on. New York City had reduced health disparities, decreased cardiovascular risk, and the list goes on. We had lower smoking rates and everything going in the right direction under Mayor Bloomberg. And so the fact that this is the anti-Bloomberg bill was very awesome to me, because Mississippi has horrible health outcomes, and they're on the bottom of every list. But the other thing it highlights is the portion cap was, yes, and not an evidence-based policy. It was based on evidence, but it was not something that we knew the outcome because it has never been tested. But that is the beauty of local governments. Local governments need to experiment, and that's one of the purposes of allowing experimentation at the local level. For some of the best or most accepted policies that we have now started in local governments. Clean Indoor Air Acts, and also the trans fat ban, menu labeling, a lot of these started in local governments. And so we need them to be able to experiment. And when they're preempted from doing so, we lose the benefit of that experimentation. And then just a final note is that local democracy is where we are closest to our elected officials at the local level. They know our needs, our values of their community, and so when you're taking away the ability to vote for something you want, there's a huge undermining of democracy, which is just part of a bigger movement going on with disenfranchisement and other things going around the country. So I beg you to look at it in this perspective of this overall undoing of democracy in America. So just in summary, we see direct attacks. There are other ones like sanctuary cities and paid sick leave, things that are clearly undermining equity, where the states are placing special interests like guns and also corporate interests above public health, and there's clear equity implications for all of these things going on. So thank you, and I look forward to when we have our group of questions. Let me just, okay.
Hi everyone, my name is Lainie Rutkow. I'm a professor at Johns Hopkins in the Department of Health Policy and Management, and I also co-direct our school's Center for Law and the Public's Health. And before I jump into this presentation, I just wanted to quickly thank our hosts today, the Eastern Region of the Network for Public Health Law, my dear colleagues, and also my co-presenters. When you think about preemption, and I've been working on issues at the intersection of preemption and public health for 10 or 15 years, and these guys are really at the top of their game. So thank you for bringing us all together like this.
Lainie, you should have gone first. I did not. Thank you, everyone.
No, I wanted you to go first because now I can build on what you were, yeah, no, you had to explain preemption. So, so the work that I'm going to talk to you about today is less, it's not so much legal research as research about law. And while my name is on the slide because I'm the one speaking to you, I did this in collaboration with colleagues over at Hopkins, Jan Vernick, who's a close collaborator with the network, as well as Sarah Wetter, who some of you know because she's former Western region of the network, and Megan McGinty. And this work was sponsored by the 21st Century Cities Initiative, which is a university-wide initiative at Johns Hopkins. So let us... Okay. So I was hoping that I would go second so that I wouldn't have to actually answer the first bullet, which is what is preemption. So thank you for doing that. But so in one sentence, right, preemption is the ability of a higher level of government to preempt or prevent a lower level of government from doing something. And why does that happen? So there are lots of different reasons, and again, this is just touching on some of the things that Jennifer spoke about. So first, sometimes the federal government says that it's preempting or preventing the states and the locals from acting in a particular area because there's a good reason, a good policy reason to have a strong, consistent national standard. Think about safety devices in cars. Like, we don't want every local government making up their own rules about that. Another reason that we see preemption, to avoid what policy folks like to call a patchwork effect. Jennifer mentioned this in the context of nutrition labeling. So the nutrition fact panel, the thing that you see if you like pick up the cereal box and flip it on its side, the white box, it's probably a good thing. It would be a very confusing patchwork, right, if every state or every local government could make up its own rules about how the food industry had to put together that nutrition labeling panel. So wanting to avoid a patchwork effect. Then another reason that we see preemption being used to prevent the local governments from regulating in a particular area. One that people talk about a lot now in public health law is sprinklers in residential housing, particularly in newly built residential housing. So a lot of states are passing their own law at the state level for requirements or non-requirements related to sprinklers in residential housing, but then they're saying, we have this law, local governments are preempted from doing anything else on their own. So states doing it, they want to prevent the locals from adding anything else. And then the final reason, and I guess to tie it back to Jennifer, I'll call it Kansas, is that a state decides that not only does it not want local regulation in a particular area, it doesn't want any regulation. So a few minutes ago, Jennifer mentioned how Kansas did, I was trying to come up with a good adjective, this very strange thing, where it said not only are we going to prevent our local governments from regulating in this area of, what is it called, food but they have that weird phrase, food-based health disparities. Not only will we prevent the local governments from doing it, we will also prevent ourselves from doing it. Okay, so those are kind of the big 4 reasons that we see preemption. And the potential consequences of preemption, and I say potential because this is really an area that's where we could use a stronger evidence base to evaluate the effects of preemptive laws. But the potential consequences, and we know this because we've seen many cases, are that local health policy innovation gets stifled. Because if local governments, as Jennifer was just saying, if they can't experiment and test out or pilot policies to respond to the specific needs of their community, if they're prevented from doing it, then we miss out on potentially innovative solutions, solutions that may ultimately get scaled up to the state and then federal level. But if the locals can't experiment at all, then we really close off this whole area of policy development. So 2 examples of the kinds of things that we see happening out there in the world right now. So one, so this is, I pulled this from one of Jennifer's, I think this was American Journal of Preventive Medicine, maybe, that just came out. So in the context of food policy, in the last decade, 12 states have passed legislation to preempt local governments in their state from acting in the area of nutrition policy. That's probably not a good thing because nutrition policy, we want to see local communities testing out different things like, say, a soda tax, and then evaluating it to see, does it work? Does it do the kinds of things that we're hoping it will do? Another example on the other side of this slide is in the context of tobacco control, which was, at least for me, the original area that I heard about with preemption. For decades, states have been preempting their local governments from doing things like enacting stronger clean indoor air laws or enacting stronger restrictions to prevent young people from accessing cigarettes. So it's sort of like I think the name of this is like Everything Old is New Again or something like that. This is very much an Everything Old is New Again story. And to get to so all of that was the setup for the study that I'm going to tell you about now. I was curious because we often hear that preemption stifles local health policy innovation. I was curious to hear, like sort of in a systematic way from local health policy leaders, what their own experiences had been with preemption, what, if any, actions they had taken when faced with preemption, and just sort of like what they think and how they work through it. So for this study, we conducted 2 national surveys. The surveys had the same questions in them, but one was for mayors and one was for health officials. Health official meaning whoever is the highest ranking health officer. Usually it's whoever runs the local health department. And the survey, it was very straightforward. It was a less than 15 minutes to take, mostly multiple choice responses and a little bit of open text. The survey was fielded from March to June of 2018, so pretty recent. And we decided to limit the survey to cities, US cities that had populations of 150,000 residents or more, and that was based on the most recent census data. The reason that we chose that number is because if you're a city of that size, you likely have a pretty robust legislative and executive branch, and in all likelihood, they're tackling an array of policy challenges. So our guess was that they had encountered preemption at some point along the way. And to get the mayoral contact information for these cities, we worked with the 21st Century Cities Initiative, which was providing support for the project, and then NACCHO, the National Association of County and City Health Officials, helped us with the health official contact information. So to recruit folks, very simple process. We would send an initial email introducing ourselves with a link to the survey, and then 2 subsequent reminder emails. And we also said in our email, I don't know how many of you have tried to get local officials to like talk to you or to do anything, but like it's not that easy. So we also said that if you want to have a designated deputy fill out the survey, that is fine with us. What we really want to know is just your local government's experience with preemption. I do not know, we deliberately did not ask who was filling out the survey, so like I can't tell you was it the mayor or the deputy mayor, which is a strategic decision because it's the kind of thing that studies show will increase likelihood of response if you're not asking for who the actual name of the person who's filling it out. And then the analysis was very straightforward, and I'll show you in a moment, just descriptive statistics, and for any open text responses, looking at them in a qualitative manner. Now, this is a horrible slide, but when I've spoken about this work, people have asked me about the cities that have 150,000 or more folks in them. So there are 159 of them in the US, and I'll just pause for a moment in case you want to look to like see if your hometown is on here. They go by size, so New York is the biggest, and then it's descending order to Rockford, Illinois, which comes in at like just over 150,000. This slide also allowed me to make sure that I still remembered the 2-letter abbreviation for each of the states. Some of the A states are really hard. Okay. And so here's what we found. So for the survey of mayors, we were able to reach, meaning that we didn't get a bounce back email or an email that someone was on vacation. We were able to successfully contact all 159 cities, and we received 45 responses. So it's a 28% response rate. Now, in other parts of my research life, I would say, oh my gosh, that's horrible. But when trying to get public officials to respond, I was like, wow, that's great. It's higher than 25%. For our health officer survey, and again, we were going to the same 159 cities, we were able to contact 141 successfully. So of the 141 successful emails, we got 45 responses. So it's a slightly higher response rate, 32%. And again, if you go into the literature on this, like deep in the poli-sci literature, which I don't suggest you do, I think you should just take my word for it, these are considered pretty good response rates among public officials, particularly among local government workers. So I'm now going to, for the most part, talk about the two survey results together because they were, in most areas, they tracked pretty closely in responses. So over 90% of respondents to both surveys, so essentially everyone, said that preemption had been an obstacle to local policymaking. And for the mayoral survey, the top 3 areas that were mentioned where preemption had been a problem were safe housing, transportation, and firearms. On the health officials survey, the 3 most common areas where preemption had been a problem were tobacco, environmental hazards, and minimum wage. And when we asked about why these local officials had concerns about preemption, so sort of like what were the legal reasons that made them concerned, one was that they were concerned that a local law that they had been working on would be negated by preemption. Another was they were concerned that if they pursued a local law or actually implemented it, they would be subject to some type of litigation due to preemption. So the state would say, legally, you're not allowed to do this, and then there would be some kind of a lawsuit. And finally, the third concern that they expressed was delays in actually implementing a law. So even if the law had been passed and they were ready to go, because there was some question about, well, is it definitely preempted? Might it be preempted? There would be a very long delay waiting to work with lawyers, both at the state level and at the city level, to kind of like figure out, can we do this or not? When we asked them what they had done, so as a city, what did you do when you were faced with preemption? And there were a host of answers. I'm just telling you the most common ones, but they were the common answers were the same across the 2 surveys. First was to abandon or delay the local policy initiative, so to just walk away from it because there was a threat of preemption. The second was to seek legal advice, and the reason I think that that's important is because that's resources. That's time, that's personnel to get into the weeds on the law to figure out, are you preempted or not? And the final answer, when faced with preemption, was that local officials had redesigned their local laws. So they would figure out what they couldn't do and then go back and rewrite the law to try to make it into something that they could do. We also asked on both surveys about how these local officials intended to address preemption in the future. So you know it's out there, you know that it could happen. What are you thinking about doing strategically so that you can advance your policy agenda? So the most common answer across both surveys was to work with advocacy organizations. And I know, because I recognize a bunch of faces, I know that some of you here work with or lead advocacy organizations. They are viewed as the #1 key player in combating preemption by local health officials. And the second answer was to work more directly with the state legislature. So to try to help or convince state-level policymakers not to preempt local governments, or at least to lessen the effect of preemption on local governments. And then we threw in this question at the end, just because I was curious, if mayors or health officials had ever felt that preemption was beneficial to them. And you'll see that the numbers are small, but it's 18% of mayors and 16% of health officials said that there had been a circumstance where preemption was helpful. I then added a box that said, please tell us more. Unfortunately, we didn't get much in those boxes, so I don't know what they were thinking when they said that. As a researcher, that makes me crazy, but I wanted to share it with you because I think it's dishonest to just tell you that it's all bad news. But I don't know what they had in mind when they gave us those responses. So what are the big picture policy implications of these findings? Well, first, this gives us a little bit of evidence to support the claim that preemption is impeding local policymakers. And we know from these responses that it's coming across a wide range of issues, right? So when I first started working on preemption, people told me, think like tobacco, food, guns. Those are the issues. Today, that is not the case. The issues really cut across. You saw I talked about transportation, safe housing, minimum wage, and I could have given you a much longer list of responses that we got. I'm just trying to summarize quickly in a presentation. To me, that means that local governments need to always be thinking about preemption because it's really not issue specific anymore. In addition, these findings, I would argue, give us evidence that preemption does indeed stifle local government innovation. The responses, the most common response that we got when asked how local governments responded to preemption was to abandon or to delay a local policy initiative. So I don't think you can't get a much stronger indicator of local policy action being stifled. And finally, another thing that this made me think about is that in the older days, with local governments being preempted from enacting tobacco control measures, there are a lot of instances where a local government that had successfully addressed preemption relative to tobacco would sort of write up a little case study and then share it with another local government to try to like quietly share best practices. And some of those ended up in the published literature. But that kind of cross-governmental information exchange was really beneficial to think through strategies to address preemption without necessarily sharing them with the whole world. Thinking beyond tobacco, that kind of thing would probably continue to be helpful among local governments to continue to have this kind of bidirectional exchange about how to address preemption successfully and also what hasn't worked to address preemption. Okay, so it says questions, but please don't ask questions because next you need to hear from our third and final panelist.
Hello, everybody. Okay. Are you tired? You need to stand up and stretch? Do you? Why don't you do it? Stand up. Stand up quickly. Stand up. Stretch a little bit. Stretch. Very good. Have a seat. We don't have all day. Come on now. Hi, everybody. I'm Glenn Schneider. I'm the Chief Program Officer with the Horizon Foundation. And I'm here to tell you a little bit about boots on the ground perspective when it comes to this sort of stuff. Just so you know, the Horizon Foundation is right in between Baltimore and DC. That's where we are located. Our vision, we are a place-based foundation. Our vision is to make sure that people have long, healthy lives. Our mission is to improve the health and wellness of the people that live and work in our community. That's what we do. So why are we here to talk about preemption? Well, we're a kind of unique foundation in many ways. One way in particular is that we look at our role as building movements to really affect change on the systems level. So we do a lot of our work when we look at how do we change our community with the money that we have available to invest. We look at it from a policy and systems angle and say, typically, that's where we're going to have our best outcomes if we work in these sort of areas. So our strategic priorities, we have 3 of them. Improving healthy kids and families, which is why I'm really here today to talk a little bit. That's to us, physical activity, nutrition, and mental health. We have promoting healthy aging, which is mental health and advanced care planning. And we have ensuring a more equitable community, which is really looking at equity from a policy and systems lens in our community to do some major changes when it comes to health disparities and health injustices. We have 4 key ways that we do our work. Programs, which to us are grants oftentimes, and sometimes programs we run in-house. Policy, which is obvious. People, which is partnership. And proof, which is having the metrics to really drive the work that we do to make sure that we are having success in our community with the investments that we make. 5 years, actually no, take it back now. 7 years ago, we launched Howard County Unsweetened, which was at the time one of the first real comprehensive sugary drink campaigns that were out there that included all different elements that you could imagine that money could buy in many instances, where we could have media campaigns and things like that. We launched that media campaign. It's still in existence today. We're on TV. We're in social media. You name it. We are all over the place in our community. We educated the public. We had street teams that went out and talked to folks about how we should reduce sugary drink consumption. We educated providers to make sure that providers were doing the best practices when it came to reducing sugary drink consumption of their patients. And then we started to work on policy. First place we thought of, you want to look at doing something about sugary drinks, you look at kids because sugary drinks are the biggest source of added calories and sugar in a child's diet today. So we went and looked at how we change our school system's wellness policy. So we did that, changing it from one of the worst in the country to one of the best. And we still work on it today to still implement it as best we can. We improved the school nutrition environment, making sure we had healthy fruits and vegetables and that we were offering better tasty food to kids so that they actually ate it more often. We also changed the environment and changing the vending machine composition that we had in our county governments, as well as in our park and recs programming that served a lot of kids, not only during the school year, but in summer camps. And we helped organizations change their own policies, so the little P's of policies, which are making sure that when you are having events like today, that you are trying to make sure that you've got healthier options available to people. So there you have it. And at Hopkins, we also worked with our hospital to help them make a change in their P so that we could have healthier things available to patients who are at the hospital. So these sort of things were happening all around. We were doing a whole bunch of work and then we hit a snag. And the snag in this case is that we really wanted to change child care policy. We thought child care policy was really important because kids spend a lot of time in child care, particularly in our community. So what could we do to make sure that kids had better access to healthier food and drinks and a more supportive physical activity environment and better support for breastfeeding mothers? And we realized very quickly, we don't control everything at the local level. Sometimes these sort of policy levers are controlled at the state level. And so we said, well, what are we going to do to change this at the statewide level? We worked with state partners to create Sugar-Free Kids. And I am here today. I got the lucky ass to be speaking to you today, but I also have with me here Sean McIntosh, who's the Executive Director of Sugar-Free Kids and Local Maryland, which we're going to talk about here in a second. So, wait, Sean. When we get questions, Sean's going to come up here and speak with us too. But anyhow, Sugar-Free Kids has all of these pretty major powerhouse organizations as its backbone to really help make sure that we are making changes on the statewide level that sort of matched the local level that we were doing in Howard County. Because we knew that we don't live in a place that has a moat around us. We are actually influenced by what happens in the statewide community. So we were fortunate. We were able to pass a statewide law that made sure that we could improve the food environment, particularly for kids. We did that. And working together with national partners, Robert Wood Johnson Foundation, thank you very much, American Heart Association and others, Voices for Healthy Kids, we actually have been trying to change the environment all throughout the state. And over the course of the last 4 years, we've been able to take healthy vending, if you will, on the road. We have passed it in a number of communities that you see here. That's a pretty big deal. In Baltimore City, we were instrumental in passing the Healthy Kids Meal Bill, which made sure that parents and kids, when they go to a restaurant, have healthier options, particularly in their drinks. When they are looking at the children's menu, that's a big deal. I think we were the first East Coast city to pass such a thing. Wilmington, Delaware followed. State of California followed that. So we actually started moving things not only here, but maybe affecting some things nationally as well. We also rallied our residents to really support all these changes. What you can see in the very itty-bitty print are all the media hits that we've had just looking at our kids' meal bill in Baltimore City. But we had similar sort of things with all those vending machine laws that we were passing in all those different communities. And so you say, okay, when are we going to get to the preemption thing, Glenn? What are you going to be talking about? Well, we started to explore local sugary drink taxes. And the minute that we started doing that, we started thinking about this in a big way, and we realized, very much using Tinder, that we make a great couple with local laws. We do a really good job when we are effective at changing local laws, and you can see local laws super like this. Isn't that cool? Sorry. In any case, why is it so important? Because you heard from Lainie, you heard from Jennifer about the importance of local innovation and how it helps drive public opinion and it helps drive progress at the statewide level. Well, that is absolutely true. As we do these things, we expect to be moving things forward along a number of different routes when it comes to sugary drink and nutrition policy. And so we realize the importance of local laws. And in fact, I should say that because of the work that we've been able to do both locally in Howard County and across the state, we have seen the impact of it in our own local community. We have been tracking sugary drink sales. Our sales are down 20% compared to controlled communities that don't have campaigns like ours. We think that there's a lot of potential when you look at how you look at policy across the state that you're working in and have that be a complement to any educational effort you're doing. At the same time that we were like, yay, local laws, the beverage industry was like, boo, local laws. And we started to get a little bit worried about how quiet all of a sudden the Beverage Association became. And why? Because just like you could imagine, they were getting a little bit tired of going community by community by community and hearing us say the same thing and educate those local folks about it and having an impact on their sales. So we started thinking that in the middle of a sugary drink tax campaign locally, perhaps, we might find that we're in there trying to pass a tax at the same time the industry is in Annapolis working on getting the state to preempt all the hard work that we've done over the last 7 years. We didn't like that thought at all. We know that preemption is a major threat. You've already heard that that is the case. But you might say, for any of you familiar with Maryland, you might say, but not in Maryland. Say it ain't so. And you know you would say that because, well, you guys in Maryland are really blue. You have a lot of Democrats. Democrats don't do these sort of things. That's terrible Republicans do that. And the answer is that's just not the case. You have to realize that preemption is a threat all over the place. And as you saw some of the maps, this is nutrition, smoke-free places, e-cigarettes, paid sick days, immigration rights, minimum wage, housing affordability. Preemption is coming up all over. And so we said, well, what can we do about it to kind of take this head on and do something about it preemptively, ahead of time? So we created an organization that is brand new, brand spanking new pretty much as of the beginning of this year. We've been doing some formative work in the later part of the fall, but we just created Local Maryland. And Local Maryland is looking at stopping preemption, particularly in 3 key areas: public health, environment, and jobs, wages, etc. And why these 3 things? These 3 things we know are highly supported by the Maryland population. They want a clean environment. They want protected public health. They want better jobs, better wages, better environment for their families. So those things are the things that we feel are the things that we can best prevent preemption on, those 3 topic areas. So what do we do about it? Number 1, we are monitoring to make sure that we don't see any number of different terrible preemptive language being introduced in bills that might exist. We are trying to determine the right messaging to talk about this, which is not an easy thing, let me tell you. And I'll get to why in a second. We're building a cross-sector coalition. I've been building coalitions for a long part of my career. And that, you know, when you've got a bunch of people who care about the exact same thing, you're golden. It's a little bit harder on preemption. We're trying to bring environmentalists to sit down with public health people, to sit down with people who are caring about wages, and to get all of us to agree on one central premise, which is we all think preemption is a good idea in this case, and that we're going to have to figure out a way to work together and stop preemption when it arises in our community. There are challenges associated with that. We also want to add elected and state officials to be a part of our coalition. We think that's going to be very important, not only as a monitoring phase, but also to help stop it when it occurs. And we're going to do a lot on the media side to let the world know that we exist. All of those things are great. And we're going to add a component, we think, here of adding some targeted social media and boosted posts to make sure that people learn about why this is so important to them and what the consequences are of allowing preemption to occur, and activating the grassroots once that happens. All of these things sounds great because we want to defeat preemption at the end of the day. But I do want to tell you about some of the challenges because I think they're really important for you to know and think about as you work with others in your community to hopefully prevent preemption. And they are very clearly, number 1, monitoring is not easy. It's not easy because there are a lot of different ways that language can allow preemption to occur. And so you have to have the help of talented people like the network and Kathy and her team here at University of Maryland and others to be able to know when preemption is being introduced, and it could come up at any point throughout a legislative process. So monitoring is not an easy thing by itself. Secondly, and this is a really biggie, preemption is a tool. That knife that you see there can chop up vegetables and make a very good salad. It can also stab you in the back and kill you. So why is this important? Because in some cases, as we talked to our new formed coalition, we found that some people said, I hate preemption except when I don't, which is really simple to say that there are times that folks in these various communities might look at preemption and say, we need the state to step in and preempt because otherwise counties are doing things that are really hurting the environment. They're really hurting public health or other things like that. So it's not a universal, I hate preemption. You heard about the nutrition facts panel. We wouldn't want 1,000 different nutrition facts panel for all of our different folks. So there are times that you look at preemption and you say, is it the proper tool to use? But it is a tool nonetheless. And to talk about preemption is wonky, wonky, wonky. No one understands what we're talking about if you use the words preemption. We're trying to talk about preemption without using the words preemption. And you're talking about one government blocking the ability of another government to do something is still very wonky. So we've spent a lot of time on trying to figure out the right language in order to communicate this to a public that otherwise is like, why are you telling me this? I don't understand. And then the cross-sector coalition building, as I said, there are times, for example, we're in one of them right now, where there is a bill that, in fact, there it is, Fight for 15, the minimum wage bill that is being heard right now in Annapolis. It's a great bill for people who support minimum wage increases. That's great. Our coalition has folks who both support the minimum wage and those who are neutral on the minimum wage. They don't have a position on it because maybe their members are aggressively either for or aggressively against, so they take no position at all. So how do you come into a bill hearing and you say, I am here to testify, I am neutral on this bill as an organization like Local Maryland should be, and I'm here to tell you, though, regardless, we hate the idea of you adding preemption to this. Local governments should have the ability to pass laws that are going to improve their lives of their residents. Plain and simple, that's why I'm here. That's a little bit confusing for some. We are trying to be aggressively neutral when it comes to these sort of matters on the bill itself, but being united around preemption so that we can stop that from happening. Okay, anyhow, back to this. It's a challenge here. We are looking for organizations. If you are connected to any of those, by the way, please let Sean or I know when we are done here today. We'd love you to sign our resolution, which we will get to you as well. There are also other opportunities, if you will, for preemption to happen. And when I told you about the blue state that we are, and certainly we don't have preemption occurring, we had preemption occur last year on a sick leave bill. And already this year, there are likely at least 4 bills that could have preemption added to them at some point during this process. We're really concerned about preemption becoming the tool that is used by all industry or special interests of any kind to stop progress at the local level and to make it much harder for people of color, for lower income communities and so forth to have the same opportunities for good health that everyone else have. So we really need to think about this and how we stop it. Finally, this is all about relationship building. We can do relationship building. It's going to take a lot of time. We're trying to develop this network, Local Maryland Network, so that we can stop preemption before it starts. We want to get to a point where the population is saying, oh, preemption, that is such an old tactic. Move on from that. That's what we're really trying for. We're probably years away from doing that, but we really hope with working with many of you in here and others that we're going to be able to stop preemption when it does occur on bills in the General Assembly. So I leave it at that. And again, we'll call up Sean when it's question time, should you have questions there. Thank you.
This is for the gentleman for Howard County. First of all, is your organization, is it a 501c3?
Yes, so we are set up almost like the American Cancer Society or the American Heart Association. So we are not a private foundation or anything like that like others are.
And the second question is, how did you get a statewide initiative passed? You know, because you're a local in Howard County,
right,
but you went from your local and went for a statewide
That's
change.
a great question. So we are a local place-based foundation, but our trustees have said many a times that when there is a direct line back to Howard County folks, and we can see it, we're willing to support that. So for example, we had no way of changing child care policy in our own community. That's all done at the state level. We don't control it. If we want to change child care in Howard County, we have to change child care at the state level. And if we do that, there's also the extra benefit of no matter where you're taking your kid, if you live on the border, you might take them to Baltimore County or Montgomery County or wherever, you have the ability to have a healthier place to have your kid. So it's about showing our trustees that there is a connection to our residents' health if we work in a collaborative way with state partners.
Yes, I'm indulging myself in a question. So we talked a lot about explicit preemption provisions and when you might want to put in an explicit non-preemption provisions, but when you're left in a world with neither of them, you're left to the vagaries of the judicial system as to whether there might be implied preemption, right? So non-lawyers in the room, a court can find that the legislature maybe didn't say they were preempting, but you can tell that they intended to preempt, mostly because they comprehensively regulated in the area. Are you aware of any states that have taken action to curtail the judiciary's ability to find implied preemption? And do you think that would be a good idea? And some people on the panel know why I'm asking that.
I love this.
Oh, wait, this was like a gotcha question?
Yeah, it is. It's a gotcha. It's a gotcha.
What happened?
Wait, no.
Tell us.
What a lovely host.
I mean, the legislator has been increasingly getting involved in judicial decisions. It's a very interesting method. So you're saying it's happened?
Yeah,
that's what they thought about happening this year in Maryland, but it didn't.
What was the bill?
It was going to be a bill that would not allow the court to find implied preemption. There could only be explicit preemption.
That's amazing. So what's the bill number?
It's not.
What area was it going to be in?
So it was basically a bill that said the General Assembly, in passing a law, must be clear about its intention whether to preempt or not. That was sort of the idea that you could get to that point. The question is, do you think that's a good idea or
they
not?
now preempt everything so they can't avoid, so yeah.
So, well, it can go either way. Maryland says Eastern counties put this out as one of their legislative priorities, and then they start thinking through, like, wait a minute, what are the potential negatives?
So we should do a study asking judges.
John?
We actually approached them and asked them to pull the bill. Because we envisioned this scenario where preemption would be put into everything.
Everything.
And that made us very nervous.
Yeah.
Well,
and
or
so
it brings it forward when otherwise people might not necessarily think about it.
it might not,
Right.
it might not be as big a fight as it will become if it has to be there. If it has to be there, it will be such a huge fight. We don't have the grassroots power to fight that yet. And the reason we created Local Maryland was to build the grassroots power to fight preemption. Because the reason preemption is winning across the country is that advocacy organizations like us do not have the grassroots power yet to fight it individually. We need to be able to fight it collectively in the way that it's impacting all of us.
I mean, and the flip could happen too if they say if there's no savings clause, there's always preemption.
But it's interesting too because like in the survey, so I agree with that. But in the survey that we did, in the survey that we did when local governments were saying that I think it was the second most common response to preemption or really concerns about preemption. So I don't know if the concerns were about express or implied, but they said that costs of litigation were their second most common concern. So it makes me wonder, like if implied preemption couldn't be a thing, a lot of the types of litigation that local governments worry about, which is like the are we preempted, are we not preempted kind of stuff sort of goes away. But again, then it could throw you into a world where it's just, well, then everything is preempted all the time.
Right, and it is conflating implied preemption and explicit preemption. We get that. We understand that what we're doing right now is conflating the two. The problem is, it's not a problem. there haven't been that many lawsuits right now here where it's that huge an issue. There have been lawsuits. There is a lawsuit right now in Washington County on solar. There's a lawsuit in Montgomery County on pesticide. You know, there may be some additional lawsuits that come down the pike, but it has not been that huge an issue. Whereas preemption language is creeping in and winning, and it happened with paid sick leave. They're going to try to do it. They are going to try to do it with Fight for 15. We know that, and we are fighting it.
Well, and so I think I don't think any of us explicitly said this, but getting a savings clause in your law is another advocacy maneuver, is like make that part of every platform for substantive laws that you have. A savings clause explicitly allows state and local governments to act, depending, you know, states if it's federal, but local for the state. So that should be part of all your advocacy efforts, is just get a savings clause in to preserve local control.
Understand this fully, but it sounds like overwhelmingly preemption is a negative when it comes to public health, the public good, or even innovation, right? We're a local health department. I work with Virgil. Are there any criteria that exist to determine whether or not preemption can be written into a law? You know, it has to meet certain things to protect public no.
No, so the local governments are a complete creation of the state. So if a state wanted to, they could actually get rid of every local government. So unfortunately, because of that, the state can always preempt. And even if you have home rule authority, which I would urge any local governments to consult your local lawyers if you do get preempted, in case you do have home rule authority or there's a procedural defect in the way they did it. You still have to remember the state legislators can change the law, you know, that gave you home rule authority, or even change the Constitution, frankly, if they're going that far. So that's what the unfortunate part of this part of preemption is.
Okay, thank you.
And the other thing is, right now at this point, the federal government has yet to just preempt without substantively acting, and that's because the supremacy clause is not a clause which gives them authority to just act on its own. However, I don't see that is going to always be like that. I could imagine the federal government passing a 0.00001 cent tax on all soda and then preempting the rest, and that would frankly be legal, probably. But states can preempt without doing anything. So they don't have to pass a substantive law, and that's why states are just preempting without any substantive action.
Thank you. So, Glenn, you talked about the difficulty of describing preemption to folks, and Lainie, I think it was you who said, because I wrote this down, ability of higher level of government to prevent lower level of governments from doing something. And because it is such a difficult thing to describe and get people to understand. So I thought, well, that's a simple way of saying it, but like you said, Glenn, even that's hard to understand. So what types
I
of...
actually tested that sentence on my mom this morning when I was on my way, because she was like, what are you doing today? I was like, you'll think it's really boring. And she was like, I probably will, but what is it again? So I was like, I'm going to speak on this panel. It's about higher level, blah, blah, blah. And my mom was like, yeah, that sounds really boring. So,
and I thought that was such an easy way to describe it. So, no, so what ways have you found to describe to lay people or communities that work and resonate?
We do talk about preserving the right of local government's ability to pass laws. So it is about protecting local democracy. And if you take a look at our website, which is localmaryland.org, it describes what we're trying to do, and it has our resolution on there in very layman's terms. You can actually sign up to join our coalition on the website. So if your organization would like to join, you may do that right there on the website. And we struggled to find ways to talk about what we're doing in a way that speaks for all of the sectors that we are representing, which are environment, public health, and wage groups, and jobs groups and so forth, and for all of Maryland, because we're spanning, environments, and we all use different languages. Public health uses a very different jargon from environmental people. So how do we use language that works for all of us? So what we have right now is something that went back to all of the organizations, and all of the people spoke for their organizations as to, yes, this works for us. It is still difficult to talk about, but when I've delivered things to the delegates, I've said, we're local Maryland. It stands for Let Our Communities Act Locally. So I mean, that's what it is. We're talking about letting our communities act locally in Maryland. That's who we are. And that's what we're talking about.
And I think we also say that we're trying to preserve the right of local governments to pass laws that would protect public health, create a clean environment, and create better jobs, and allow them to actually work with their citizens to provide the kind of outcomes that we're all looking for. So I mean, it's really about preserving their ability to do it. We know that special interests are blocking the ability of these sort of things to happen at the state level through the state legislature, and that's where it gets tricky. Yes. It gets tricky with the understanding like, well, hold on, special interests are blocking. How are they blocking? Well, they're going to your state lawmakers and convincing them to pass a law that would block your county council from doing X, Y, or Z. So definitely take a look at the website. There's a whole lot of stuff there. To the extent that you are trying to do this work and you join with us, we will also be sending you our talking points and all the rest. We'd love to have you be a part of that as well.
Right. I would say we have messaging for the public and for the legislators. It's two different messages, because we have to be really judicious in how we use the messaging about special interests and business lobbyists, because I will say that some of the legislators don't take kindly to hearing that. So you have to be really careful how you use that.
Mm-hmm.
Well, great. Thank you guys so much. I literally could sit here all day and talk about this, as you're well aware, because in Maryland it's a significant issue. I just want to let folks, particularly folks in Maryland in the room, know that we do through the Legal Resource Center for Public Health Law have a legislative tracker where we track a variety of different types of legislation pending in the Maryland General Assembly. And this year is our first year where, for all of the legislation we're tracking, the students are they're searching through the bills to make sure if there's language about preemption, we put that in our bill summary. So if you're on the Ledge Tracker, you should be able to see if we're noticing it. What would be the next level is doing an assessment on a particular bill as to whether there might be implied preemption, that judicial finding of preemption. We're nowhere near able to do that when there's 3,000 bills presented in the General Assembly annually. But I think that's something that maybe the fiscal and policy note ought to start including at least an analysis of. So thank you for indulging me with this discussion on preemption, and thank you all for being here. I appreciate it significantly. Thank you. So, Lee, sorry. If you email me, just email me. If you're not on the Ledge Tracker, just email me and I'll get you on the Ledge Tracker. So we are going to change out and have our last panel of the day. So claps for these guys. And